All right, so we're back with Miss Valerie Crossan with Aspen Lasers. Valerie, welcome back. We had a great talk last week or the week before on photobiomodulation. Today we're going to talk lasers. How you doing today?
I'm fabulous. Yourself?
I am absolutely peaches, I should say.
Good.
Just a wonderful day here in Virginia when we're getting up into the mid 60s and it's starting to warm up and spring is on its way. And this weekend is daylight savings. So we're going to have extra hours of sunshine here very soon. So, Valerie, we both work in multiple industries. I'd say we're kind of in the with the photobiomodulation that can get into health and wellness and get into aspects. But when you're getting into lasers, that's going to be sometimes more of a medical use. And being that I'm still in the medical industry, I always have a lot of curiosity about that because that technology is very cutting edge. It's being put to use for a lot of different things. So tell us a little bit about Aspen Lasers. Let's talk first about what is laser therapy.
Perfect. So I'm going to back up just a second and introduce myself because I want people to
Please do. I'm
understand that
sorry.
that's okay. I want people to understand that I actually have the authority to say the things I'm about to say because I'm going to make some pretty big statements and every one of them has foundation. So really quickly, I'm the VP of sales and the clinical director with Aspen Laser Systems. My former life, I was a nurse for 20 years and I've been in the light therapy industry for 16. The school of hard knocks is the best way to say that because the interesting thing about photobiomodulation or light therapy of any type is it's physics based, and so there are good, bad, and ugly devices in the industry, and in spite of that, even done wrong, light therapy is better than not doing it all because it accelerates healing at a cellular level. So Aspen Lasers is considered a leader in the industry for a couple of reasons. Our CEO and founder Charles Vorwaller and his son Justin Vorwaller operate and own Aspen Laser. Charles has been in the light therapy industry for over 35 years, Justin for 15, myself for 16. The top five people in our company have over 80 years of combined experience. So we have a wealth of information to draw from both the regulatory side, how to design equipment that's effective, and then the clinical side to apply that equipment in a very safe, simple operation because most of the time doctors delegate it to technicians who have very little foundational background. And the good news is it's simple enough to run that they can. So your first question is, what is laser therapy? It's the same as photobiomodulation that we talked about last week, which is the application of light of very specific parameters to cells that are sick, degenerating, or at risk of dying. And it basically removes the roadblocks that keep the cells from breathing well and allows, when it removes those roadblocks, that it's a molecule that binds up an oxygen receptor in the energy production cycle. And when that happens, the cell gets very inflamed, very stressed, and the healing process slows down or gets stuck in a chronic state, right? When you add light to that formula, it displaces that molecule. When it displaces it, it does it very significantly. And what's neat is the local blood vessels will absorb that light and create a transient burst of increased circulation by vasodilation. So it's a very positive side effect, and it gets rid of the negative molecule completely. Now oxygen can attach like it's supposed to, and it attaches in a place in the energy production cycle. So the cells start to breathe again, they start to make energy again, and they make a 16-fold increase in energy production with this process with oxygen in place than without, where the molecule is binding inappropriately. So it's a massive uptake in energy production, which is really important because we cannot store energy. So if we don't have it available, it stresses the cells and causes inflammation and oxidative stress. But when we reverse that process by adding light, properly dosed, then it actually accelerates healing because it restores natural cellular function, and the cells are very well designed to heal. We just have to get the roadblocks out of the way and provide those building blocks again. So the beautiful thing and the difficult thing to grasp about light for most people is that it works on everything. It doesn't work on everything. It works on this receptor site really well. But the neat thing is the cells have anywhere from hundreds to tens of thousands to some studies say 2.5 million receptor sites in the nervous tissue cells. So the bottom line is if this receptor is bound up inappropriately, those tissues can't make the energy they need to work. When we shine light on it, they can, and they start to heal again. So it can be a very profound therapy, and we can point it at every type of tissue. The question is, can we reach it? And that's where the physics comes in, and where the manufacturer needs to know what they're doing, because inappropriately designed equipment does not, it's like giving a baby aspirin for a migraine. It's not going to, it's right, the right class of medicine, but it's not going to work very well because it's an underdosed technology. Same thing in light. If you're underdosed, it's not very impressive, but done correctly, it's massively effective. And it's simply math. We literally have spreadsheets that calculate the dose for us as it travels into the tissue. So we know what the setting to set at the depth of the target we're trying to reach. And it's literally that simple.
Yeah, it's really like a chart that you go into. So what are the benefits of laser therapy?
Well, so when you remove the roadblocks to cellular healing and bring back the building blocks, the cells start to heal. So the first things that people feel is typically with lasers, I can take the most significant pain and get it gone in 10 minutes or less. I kid you not, in almost anything that I pointed at. So immediate warming sensation, very tactile, very pleasant, reduces pain and inflammation dramatically right off the bat. If you do it consistently over a period of 2 to 3 weeks, that those results become cumulatively better and more sustaining through the healing process. If you stop partway through, do 1 or 2 sessions, you're going to get stuck at chronic again. But if you guide it all the way through the healing curve, those things get better and they stay better. If there's a mechanical dysfunction, underlying mechanical dysfunction, like arthritis or maybe a disc or a spur, those things don't go away. Those are mechanical problems that we live with. Then it becomes a maintenance. The good news is once you get it under control, it doesn't take very much to keep it under control. So you just come back for 1 or 2 sessions as needed. And so the things that it helps for, again, reducing inflammation, increasing circulation. So we can use it on, I always start at the top of my head and go down to my bottom of my feet, because it literally can be used anywhere if I can reach it. So there's significant work, both in the literature and clinically, on cognitive health. So improving memory, focus, sleep patterns, we get better rest, PTSD, anxiety, ADD, all of these things get better under scope of license, because it's the practice of medicine. So it has to be the right medical director overseeing that. So under scope of practice. Aches and pains and creaky joints, I don't care if it's neck pain, shoulder pain, hip pain, knee pain, foot pain, neuropathy, neuropathic pain. If it hurts, light, again, manages pain and stimulates a repair process so that pain becomes long-lasting pain relief. So aches and pains and creaky joints. If we can reach the deeper targets, and that takes very specific equipment, I've actually seen things like kidneys get healthier. I have some amazing stories I could tell you. But the point is if we can reach it with the correct doses, things will get better. The FDA clearances are mostly around aches and pains and creaky joints. So again, if you go outside those, it has to be based on the scope of practice of the health professional. That is the medical director for that device. Doesn't mean that person has to run the laser. It means they're the overseeing license.
Right. And so I know I've got some scripted questions here that I'm going to ask you, but being that I'm still in the medical industry and I'm, like we talked before the call, I'm setting up a big surgery center down in Mexico right now, and I still work with a lot of different medical professionals. What are the applications? Like, who are the medical professionals that could get the best use out of this technology? And, where do you see it being used at?
Perfect. So the number one adopter are chiropractors. The reason for that is everybody that walks through their door has musculoskeletal pain and dysfunction. That's why they're there. And they work on the mechanical dysfunction, the misalignments, the subluxations, those kinds of things. Light works on the soft tissue. So it's incredibly synergistic with what they do and in perfect alignment with their value system, which is restoring the innate capability of the cells to heal. And so they take the pressure off the nerves with their manipulations, and we take the inflammation out of the nerves and the soft tissue, and the two make things work way, way better together than separately. The second most common adopter is physical therapy for the exact same reason. They're a little bit slower to adopt because they typically are focused on an insurance-based practice, but more and more of them are looking for outside revenue streams that are cash-based, and laser is not covered by most insurance. However, there has recently been a couple of codes released that sounds like insurance is going to start doing some reimbursement. So we're still working on understanding that a bit more. And I'm on the fence, frankly, because insurance typically limits the number of sessions that can be given and the price that we can charge for them. I'm not saying we should knock people's heads off, but we should charge, I think, between $45 and $50 a session, because it's very close to a copay, and it's so people don't feel like they're being taken advantage of. It works incredibly well. They can do as many sessions as is necessary to get their condition under control. They can afford it, and it works. So, and the average treatment process is between 6 to 10 sessions, and they're back into that maintenance phase or fully resolved. Acute conditions tend to completely resolve. Chronic conditions go back into a maintenance phase. And so that's our two primary adopters. We do have a lot of, honestly, individuals that purchase the equipment. They just have to use it for personal use. They cannot treat others because it is considered the practice of medicine. So with their health professionals' endorsement and prescription, we can put it in private homes and teach people how to use those as well. So that's the top three adopters. Sports medicine is another huge, because of the traumatic brain injuries in many sports, because of the musculoskeletal aches and pains that keep them out of, it accelerates recovery by 30 to 40% in injuries. And in our full body devices, which we talked about last week, it shortens recovery time dramatically so that they recover faster, can perform better. So it's an amazing combination together. So that would probably be our top responders.
We spoke before the call also, and when people are working with you with Aspen Laser, you're basically on site. Like there's a lot of training, there's a lot of on-site personal attention that goes in. And so once somebody says, "Hey, I want to implement this into my practice or into our facility," give me a little bit of the process of how they would contact you, what you do as far as providing training and ongoing support, because I know the company does a phenomenal job with that, but walk me through that just to give me a little more information.
So there's typically two steps, because even though chiropractors and physical therapists understand the mechanisms of action and how light works, the industry is wrought with poorly designed equipment. And so they don't really know who to believe anymore, because the science says it should. They've seen equipment that doesn't, and nobody wants to invest money in a product that doesn't perform, right? Because we've all had something we hang clothes on that we shouldn't have bought. So when it comes to lasers, what we offer is a no obligation, no cost demonstration in their practice with their clients. So we ask them to set up a client every 15 to 20 minutes for 3 to 4 hours, and as diverse of conditions and the most difficult conditions they can find, and put us to test. Because I walk in, I sit down, set up my equipment, sit down with their clients, and we basically just run for 4 hours. And when you get client after client after client with their eyebrows and their hairline going, "Oh my gosh, I can't believe this. And taking pain scales from 8 to 1 in 12 minutes or less over and over and over, there's no question that the technology works, either for the client or the doctor at that point. And the beautiful thing is when you show a client, now they feel comfortable investing their money as well. So they don't mind signing up for a package because they just were shown how well it works. So then the doctor tends to, I have about a 95% close rate when I do that, because they know that should work. Now they found the equipment that does work. So then I come back at the next available time. I spend a full day in the practice. We line up clients. We spend about a half an hour with the doctor and staff just to do an orientation and answer any remaining questions. I have a training video that they watch before we get there, and several actual protocols that have been recorded so they can watch the process. Then we set up patients usually from 9 to noon or 9 to lunch, and then from lunch break till about 3 or 3:30 in the afternoon. We want to train at least 2 technicians for obvious reasons, and we'll train up to 4 in that day, because you get more than that, nobody gets enough hands-on time. So they are now running the lasers. I'll do the first one, I'll talk through the second one, and then I turn it over and I tweak and adjust to what they're doing throughout the day, so that I make sure they can not only run it adequately, but they can talk to the clients and answer the questions appropriately. And by the end of the day, all their questions are gone. They feel very comfortable and they're ready to run a business around the device, because it's not difficult to run. It's very difficult technology to understand because it's physics. But once we program the equipment with the the very simple settings, and all they have to do is understand the depth of the target we're trying to reach. They push a button, the laser's ready, and we point it where it hurts, how long till it feels better, rinse and repeat. Because sometimes, today I just did a practice here in Kansas, and I had a young lady who had a very large rod put into her second hip replacement. And in the position of the hip replacement, she was a surgical nurse. She knew exactly what happened. She had a lot of residual pain because of the position she was in that long surgery. It was groin pain, bursa pain, which is the outside of the hip, IT, which goes from the hip to the knee pain, which was what the surgery was, and low back and glutes. I got it all done in 15 minutes, and she walked out of there pain-free, blew her away. She was previously on steroids for a week because she had such severe pain she couldn't function. She'd been off the steroids for at least a week, but she was still struggling. And I got her pain-free in 15 minutes, blew her away. She's a nurse of 20 some years, right? And the
Right.
doctor too. Those are the things that I'm used to seeing, but my clients would never believe me if I just told them. So I proved
Right.
my equipment, and I'm happy to do it because it works.
That's awesome. So just real quick, bringing that up, can you use the lasers on areas that have had like prosthetics or had knee surgery, or do you work it around
Yes,
those?
because light is warm at the surface. It feels like a warm stone massage. It's a phenomenally comfortable modality, but light scatters 30 degrees in every direction. And as that beam gets wider and deeper, the area it's going into gets bigger, therefore it gets less intense. So it goes from a warm to cold almost immediately. And by the time it's 6 centimeters deep, it's very low intensity, but high enough intensity to stimulate tissue repair. That's why we ask ourselves, how deep is the target when we're choosing our settings? Once we know that, the formula that's calculated by a spreadsheet tells us how deep. We just push a button, go. And so, yes, the equipment's extremely simple to operate, and we can treat almost everything with it.
Yeah, because I work with a lot of other energy and frequency stuff, and some of it is like you cannot use it anywhere near a
Yeah.
prosthetic or any type of implant just because it will heat it up. And obviously, you don't want that.
And
So,
like ultrasound, for example, ultrasound will warm things up because that light, that energy stays focused. Light diverges and scatters, so it's cold on the inside. And that's where the nickname cold laser therapy came from, because it's warm on the outside, cold on the inside. But that's
I
actually
love
an
that.
interesting point too. I should make a differentiation. Well, not only are there different manufacturers out there, but there are different classes of lasers. And this is the most confusing topic for practitioners that are trying to choose a device. Is the class 3B companies say class 4 is too strong, it's going to burn you, which is an absolute fallacy. The class 4 companies know, and the research is now supporting it. There's actually a recent systematic review of the literature that says the number one cause of failure in outcomes is underdosing. So not enough light, not enough quantity of light, and making sure the intensity is correct. The intensity determines how the tissue responds. The quantity determines if we get enough light to get the job done. And so the underdosing is the number one reason for failure of outcomes. So in, again, class 3B versus class 4, class 3B will get the job done if you have a lot of time. And spent 5 years there. I saw miracles, but you have to have weeks to get the response that we can get in 1 to 2 sessions with the class 4 laser. Now you add that to 2 weeks of care and you knock it out of the park for your client, and they're extremely happy that you did.
That's awesome. Well, so Valerie, we did a call on Aspen Laser also is a leader in the photobiomodulation, which is the red light therapy. I want to say the tanning beds, tanning or not the booths, the beds, it's red
Full
light
body red light
therapy.
therapy devices, yes.
And you did a phenomenal job breaking that down. So, like in that field, you're having a massive amount of people jumping into it, but you did a very good job explaining why this product is superior, what it has that others don't. I know that this whole backbone of this company is coming from Aspen Laser, which you very well talked about the experience of these people. And I know Aspen Laser is the A grade, is the standard
Best
that's
in
set
class.
in the industry. So if I'm a chiropractor, somebody that's out there that's looking at this technology, explain to me what it is that makes that such a superior product in the marketplace.
Absolutely. Thank you for asking, because that's honestly, that's a huge, once you know equipment works, you need to know that it's going to be worth the investment that you're making, because they are an investment that it returns on investment, though, in about 3 to 4 months, you've paid for your equipment with the work that it does in your practice, which is fabulous. But why Aspen? Number one, again, 80 years plus of expertise, regulatory expertise. There's a lot of lasers that have not gone through the proper regulatory channels, and that's a buyer beware. It's a risk because I've even seen people buying from overseas with in getting lucky to get them through customs, and they can get them confiscated at any point. But that's neither here nor there. So why Aspen Laser? The quality of manufacturing. We buy our diodes out of Germany. They are the best diodes in the world. We literally expect them to live and work in the field for 10 to 15 years and beyond when they're managed properly. And all that means is you have to cool them for 2 minutes before you turn the equipment off. That's the whole entirety of the maintenance. So that's number one. Number two, in comparison, many of the 90+% of the manufacturers in this industry buy their diodes out of Taiwan and China. Why that's, we started there because they're obviously much more cost effective. The unfortunate piece is they have about a lifespan of a year to maybe a year and a half, and they do not support them. So you won't get them replaced. So you're out of luck. Your equipment dies in a year and a half, and you're still paying 5 years worth of term for it if you financed it. So longevity, our equipment literally lasts for years and years. Quality of manufacturing. Our devices are bigger than what you see in most of the cases. And the reason for that is if you don't cool those diodes appropriately while they're being used, they don't last. And so these tiny little portable, very mobile devices are not going to last very long in the field. And then it comes to post-sale support. Most of the companies that are out there, the number one complaint I hear from customers that are upgrading into our equipment is, I couldn't get anybody to help me. Once I paid for that, I didn't get clinical training. I didn't get on-site training. They shipped it to me. They gave me a video or just said, good luck. Some of them just gave them a manual of how to turn it on and said, good luck. They didn't get any education and training. Then when it comes to service that equipment, it was a very difficult process as well. So the key is the partner that you're partnering with not only needs to have quality equipment that works, they need to be able to train you how it works, be able to be there for post-sale support clinically, and then post-sale support on the service side if something were to happen. If your equipment, and it's ours, goes down for whatever reason, sometimes I've had people damage it unintentionally. Somebody tripped on a cord or something and tipped it over. That's unfortunate. Once in a blue moon, we have a part that goes out. If that happens, we send you a device, and in the mail, you get it in 1 to 2 days. We fix yours and return it to you. That way you're not out of business while your equipment's being serviced. And I've worked for other companies that literally you'll wait up to 2 weeks to get your equipment back. That's not acceptable because it's a money revenue generating, and you got people halfway through their protocols when that equipment goes down. You need to continue to care. So we support our clients. I have to be honest with you. I've been working in this industry for 16 years. I have never worked with a more ethical, more reputable company. We are truly best in class. And that, for me, I'm an independent contractor for a reason. If I find a better product or a better company, I will take that to my customers. But I love this company. It does a great job for its clients.
I love that. And that was the thing I really picked up on when we were talking about the photobiomodulation as well, is that the quality of the company, the quality of the products, the quality of service is second to none. And they really do, hold the highest standards. And those are all important things. So, in the short term, you might get something for a little bit less money, but you need that
Everywhere.
comfort zone to know. And the last time we spoke, and I'm just going to say this because this is something you shared with me, you were only going to be home like 2 days in the last 30 because you were on the road like you are right now. You're on the road right now, and you're in the field on a day-to-day basis, training these people, training the docs, training the people using the technology, being there on site to walk them through. And then with all that expertise and all that knowledge base, you're really providing a much greater service than just like you said, just sending a piece of equipment with a video and saying, here you go, figure it out. And
All of our
that's
team has
huge.
been trained by me personally, and they have to sign off and be signed off on before they can go in the field. So It's not, our entire team is trained to the same standard of care. And our installer, sometimes we'll sell them and somebody else will do the installation. You're going to get the same training, no matter who comes to your, because we follow the same process together. And that's
Right.
what makes it
So
easy.
go ahead. Yeah.
That's what makes it easy to be consistent and have predictable outcomes.
Right. And I love the fact it's a tight group, a very well experienced group. Everybody's networked in. And therefore, when you're bringing people in underneath you, they're all getting that same type of training. So you talked earlier about the lasers being used for pain, being used for chiropractors. Are there any additional benefits or uses that you're seeing with lasers that are breaking off from that traditional medical role? Is there other things that are out there, maybe in the wellness industry or for dermatology or anything else that lasers have applications for?
Oh, the answer is yes, because again, if it's part of the human anatomy that I can reach, it can positively affect it. So we have a lot of functional medicine doctors that use them for not just aches and pains and creaky joints, but they'll do it for glands and organs if they can reach them. We have people that use them for facials and aesthetics. It's not as fast as your Botox, I'll be honest with you, but it's natural and there's no side effects. So it's about a value system on that particular application. Occupational therapists use it for rehabilitation of hand and, the occupational things that they do. So hands and arms and necks and speech. And I mean, there's literally nothing you can't, if you reach it and you know the cause, so I'll give you an example of where light doesn't work. If we're pointing it at the wrong spot, we're using the wrong settings. And things like, I have a case of what's called restless leg syndrome. I have no idea where to treat it. It's neurological dysfunction, and it's literally the whole legs. I don't know what causes it, nor does science. I've read for 25 years, I've read literature trying to figure out what causes this. Because I don't know where to point it, I can't fix it. It has gotten better in the bed. There's some sort of a systemic response, but I don't know where to point the laser. So there's an example. You have to know what the root cause of the condition is and point it at that problem, which is not difficult in musculoskeletal or cognitive health. It's just knowing what the part of the brain that runs the problem. So it can be used on the cognitive side. Again, another thing is strokes, post-stroke recovery. So doctors that have that scope of practice that can work with people with any sort of mental or cognitive or brain-related condition can use lasers effectively. Which, by the way, one more differentiating point, you have to use a laser for cognitive health for sustaining outcomes. LEDs can get the job done. There's little LEDs that go up the nose. There's big helmets that they wear, but it's very transient, temporary outcomes. There's not enough photons that reach the brain because it can't get there with enough quantity unless you have a laser. So that's a clear differentiating point.
So let me ask you this: how do you choose a good laser? Are there different varieties? Like, tell me a little bit about that, and how do you, when you're out there, how do you find the right one?
So the key is, again, that there's 4 parameters that make light work better. The color is the first parameter. It's the medicine of light. Red and near infrared wavelengths are the colors that it's between 600 and 1100 nanometers. That just is the measurement of the rate of oscillation of light. So red is the 600 wavelengths. The 700 wavelengths don't do much. 800 range is the deepest penetrating color of light historically. The 900s are very shallow. They're actually more shallow than the red because there's a massive water absorption in the 900 wavelengths. So the lower the 900s, the closer it is to 800, it's deeper. But as you go up through that 900 range, it gets more and more shallow. And therefore, it's not reaching the targets like it ought to, right? So we use a little bit of it because it actually increases the redox potential of the cell membrane, which is the ability of it's electrical gradients. And so the gated ion channels, the gates that open and close on the cell membrane and decide what comes in and out of that cell are balanced electrically. And so that's an important function. So the 980 helps to balance and normalize that. So we want a little bit of that in there for that water absorption, but not a lot. And then the 1064 is a recent addition to the parameters because we know it goes up to 1100 nanometers. And 1064 is another very deep penetrating color with a high, it's called action spectra, absorption in the enzyme that we're trying to target. And again, there's hundreds to thousands of those per cell. So we have to reach it and it has to be absorbed in that molecule to be effective. So we use a combination of 4 wavelengths in our laser. And we are the only company that blends them together in a fiber optic cable. So you're getting them all at the same time. 2 schools of thought there is that the shallower colors actually get pulled a bit deeper by blending them with the deeper colors, but they all have a very high action spectra in that enzyme that we're trying to target. So color is the first most important thing. The second one is the intensity of light, and I inferred this earlier. Intensity determines tissue response. We have low intensity, which stimulates, moderate intensity, which inhibits, and inhibition can be used to our advantage. We can down-regulate alpha and C fibers. Those are nerve pathways that are pain pathways. When we down-regulate them, it temporarily inhibits the pain response without doing any negative, there's no negative side effects to it. It wears off in a couple of hours, but all the healing stimulatory side that's been delivered is actually working behind the scenes, if you will, helping the cells to heal and the inflammation to go down. So the true lasting healing benefit and pain relief benefit comes through the healing process. So we stimulate or inhibit. The third thing that light can do is actually become thermal. Thermal is the types of lasers that are aesthetic lasers or ablative lasers or surgical lasers. They're not in the therapy laser industry. Mishandled, class 4 lasers can cause burns to skin, and it is what it is. There's what they call an adverse report that goes to the FDA. It's called a MAUD report. It's an adverse event. Aspen has not had a single adverse event in the 10 years since it's opened its doors. So it's again about enough light to get the job done. We pulse our light very specifically, intending to keep the thermal response out of it. The intensity is lower, more appropriate for healing, and there's no risk of thermal injury. So when the doctor now delegates that technology to a technician, they can do that with peace of mind because it's not going to burn anybody because we teach them how to use it properly. So that's point number 2. Quantity, which is a power parameter, is the next most important thing. You have to have enough light. Again, the number 1 cause of failed studies is under treating. The spreadsheet that I can share with you at another time, but literally shows you the watts to use based on the depth of the target because light gets weaker as it goes into the tissue. Think about that. And as that tissue is all absorbing light, by the time it reaches those deeper targets, there has to be light left over to get the job done. So light transmits and gets absorbed all the way through. You have to use, our average setting is 25 and 30 watts of light for our deeper tissue targets. We use up to 35 on your low backs and your glutes, your big hamstrings, muscles, things like that. And in the shallower tissues, we use an average of 10 watts. Again, pulsed, non-thermal, stimulatory, and healing things. So color first, intensity second, quantity third. Then it comes to how you treat. Techniques matter because we have to tweak. The techniques we use manipulates the physics to our advantage. So we're in direct contact with the skin. We treat in a 3x5 or a 2x7 area with pressure in a very slow grid pattern. So it feels like a warm stone massage, but it allows that light to go deep with enough quantity to be effective. And then the last thing is interval. How often do you treat? Minimally twice a week, ideally 3 times a week. You can do daily. It's just not, feasible in a busy practice setting. So 2 to 3 times a week stimulates repair in a very consistent manner and gets them through that chronic, through into the acute and all the way through to the other side of healing. So we go through the journey of healing to the other side in 2 to 3 weeks. So those are the things that matter for optimal outcomes. And it's very predictable because it's dose dependent. We literally have math calculating the doses on this process. So you can expect it to get better every single time.
Yeah, we talked about that last time where it's really broken down. It's an exact science, it's physics, and there's no guessing games. Just real quick, we talk about light dispersing. Oh, sorry.
I had housekeeping trying to come on in, so we'll pause and
get
it out.
So a laser basically is pinpointing light, but when that light gets pinpointed, how much area does that light spread out into?
Oh, that's an interesting point. So here's the thing about lasers. Lasers are collimated beams, which means pinpoint, right? But all therapy lasers literally diverge that beam into a larger area. So our handpiece is 3 centimeters across, but it's still a light source that doesn't diverge. If I point that beam at the wall, it's going to stay in that 3 centimeter circle. When I put it against the skin, it scatters 30 degrees in every direction. It becomes legitimately, it becomes a cone. And so and it goes wide and deep. So it gets weak super fast as it's going through the target, which is again why you have to start with stronger light sources to be able to reach those deeper targets with enough intensity to truly be therapeutic.
That kind of goes back to what you were saying earlier, is one of the biggest problems with lasers is that they don't provide enough light to the areas that you need them to. And then that goes back to the fact that maybe you're just not using one that's strong enough, that's really penetrating to where it needs to
Correct.
be or is
There's,
powerful.
there's one other kind of device. There's another flaw in the devices in the market that should be drawn attention to. If you have somebody that is trying to sell you a device that is treating off skin, turn around and go in the other direction. And here's the reason why. There's two physics principles that make a difference here. The first one is called reflection. Our skin is designed to protect us from sunlight. Okay, it bounces light back into the atmosphere. The drier the skin, the more reflection there is. If you are coming off skin with a light source, 90% of that light bounces into the atmosphere and is gone forever. The 10% that remains gets absorbed very superficially in the skin. So it's a terrible delivery system. Again, ours is in direct contact with pressure. The second thing in that whole scenario is the inverse square law. When light leaves the aperture, it starts to scatter, and it goes 30 degrees in every direction and becomes exponentially weaker. So it's a formula of pi r squared times the radius divided by the radius times. Point of my is it's math and physics. Forgive me, I'm sorry, the phone is ringing. The inverse square law makes that light exponentially weaker by the time it reaches the target. Then it hits the skin and bounces away. So you're a diluted dose when it reaches there, then most of it goes away. You are a completely ineffectual therapy, and they're very expensive lasers. And the reason that they're successfully selling is they say they're hands-free. You don't have to attend them. Well, that's technically illegal according to the FDA, because class 4 lasers, by definition, need to be attended. That's the rules. So it's a very, very poor design. Can you pause for just 1 second?
Of course.
I'm so sorry for that. Do you want me to repeat that? I'll have to obviously
Oh,
edit
you're
it out.
good. You're good. I
I have
just
a
want to make
four
sure you're
o'clock
getting
checkout.
clean towels and everything's going good at that room. That's more
No,
important than
they
anything.
infuriate me because I do a 4 o'clock checkout on purpose, because I work for several hours before I hit the road,
Yeah.
and they do it every time. It's like nobody reads. It frustrates
Nobody's
me.
getting the memo. Yeah, no, I
Yeah,
get
I
that
don't want to do
totally.
this. I don't
And
want
I'm
to
the
get
same way.
everything by
It's
the
like, okay, I
phone.
need to just get some more stuff done. The late checkout though is really nice when you get that availability.
Yeah.
So we probably getting close to the end of this call. We can do another one in the future because I do have another call I need to jump on here in about 10 minutes. But
Can I can I
before,
just bring in two more very small topics? The
yes,
first, the
please,
question I always
absolutely.
get is it dangerous? There are no negative side effects to properly dosed light. That's the one thing. The second one is they're proof. There are over 50,000 double-blind and laboratory studies in PubMed, which is the National Institutes of Health largest database. And across the board, the mechanism of action says it's safe, non-invasive, cannot harm you when properly dosed, and it works. And there's even systematic reviews that say it's more profound than any pharmaceutical on the market. So it's pretty neat stuff.
I love that. And I know, being in the medical industry and still doing stuff, and I'm going to talk to some of the doctors that are doing the work with the ORs because we're setting up a lot of operating rooms and surgery centers. And you can talk to them, and we'll probably do another call just on some of the benefits of that because the applications of the light is really starting to expand. You were talking earlier about how it speeds up recovery. We are getting a little close to the end, but if you want to touch on that real quick, we can
Really
go back
quickly, I'd
into that in
love
more
to.
depth.
So
Yeah.
light is actually cell protective as well as restorative. So if you pre-treat preoperatively for 2 to 3 sessions, 2 to 3 days prior to the surgery, and then immediately post-operatively, as quickly as you can get to that area, whether they let you take the dressings off or not, but the sooner you can get to it, you legitimately will have significantly less bleeding during the surgery. They'll have less inflammation post-operatively, which means less pain post-operatively, and it will heal 30% faster with light than without. Lasers make surgeons look really, really good on the
I love
recovery.
that.
Obviously, they do their
Yeah.
job. They do a
And
great
you're, yeah,
job.
and you're already going to be doing stuff for post-op, pre-op anyway. So to
Yeah.
incorporate this as another, layer, and then to give people that feeling of knowing that they're going to recover faster.
That's
And
why
does
physical
it?
therapists love it, because they're often the
Yeah,
person taking that client through the recovery stage after
right.
post-operatively. So physical therapists, it helps them do their job extremely well.
I love that. And that just so many different applications. So now we're going to mention this video. I'm going to have all your contact information down here at the bottom so that they can contact you. If they mention USA MedBed, Valerie, you give them special perks and VIP treatment
Oh,
that they would
cool.
normally never get anywhere else. Although that's not true.
I'll do that
Everybody and
just for
everybody
you.
gets it. But I'm going to put that on there just so that if you are calling, just mention the video and Valerie will know where you came in from, and that'll kind of help
That does
figure
help.
out, but there might be some special perks that you can throw in. I'm not going to say anything for sure because we don't know that, but it sounds good. So Valerie, before we sign off, we're going to be doing an ongoing series with Aspen Laser. We can go into even more specifics on some of the stuff we've talked about today. If you have questions, feel free to ask us, contact Valerie, and we'll do more. But Valerie, before we sign off today, is there anything else you'd like to finish up with?
Um, I don't think so. We covered a lot. The bottom line is,
We did.
I've never seen a more safe, non-invasive, effective therapy. It's truly, um, I actually read a, I would do actually read I think of it on the wall today, and it talked about Thomas Edison saying basically the future of medicine is the things that support wellness and healing. And I think it's ironic because he's the guy that invented the light bulb, right?
Yeah, and there's one
And
right
Albert
right
Einstein
next to me.
is the one
Yeah,
that first conceived of lasers. It was a concept. He didn't, way back when, and then in the 60s, the first laser was created based on his original work and assumptions. Two of the world's geniuses have both
yeah.
identified light as profound, and we're now applying that today in ways that we never would have. As a 20-year nurse, would have never believed had I not seen it for myself.
And it's really moving fast. It's super exciting. And, companies like Aspen Laser are really at the forefront developing and pushing the technology, which is really exciting because there's no telling where we'll be 3, 4, 5 years, even a year from now. So Valerie, once again, thank you so much. I love these
It's my
calls.
pleasure.
I want to do more, on these other products. If you didn't see the first video that we did with Valerie with the red light therapy, that was a phenomenal video. Once again, all the clinical information, all the science, all the physics, and once again, another product, probably more geared for wellness centers, homes for sure, and other applications, but also, once again, something you could bring in to a chiropractic office or these other types of facilities. So this is going to be an ongoing series, and that video is already out there. So you can go to our YouTube channel and subscribe and get all the updated videos that we do. Valerie, once again, it's great to talk to you. I love all the information. I'm excited every time I get on the phone with you. Thank you for your time today. Stay with me. I'm going to sign off on the call, but I'll stay with you here. And
It's been a
have
pleasure.
yourself a great afternoon, and we'll talk soon.
Thank you. Bye-bye. I'll just
Okay, we need to just touch on this. Tell us a little bit more about some of these doctors and how this technology is being brought into the medical field.
Well, so it's interesting because traditionally chiropractors and physical therapists have been our number one adopters, but recently in the last 2 to 3 years, we're seeing more and more, quote, mainstream medicine practitioners, your MDs, your neurologists coming on board and exploring red light therapy, both the lasers and the light beds. I'm currently working with a world-renowned neurosurgeon, and his partner is a spinal surgeon out of Minneapolis, and they're opening clinics across Minnesota and eventually across the country. Because of there's a big gap between, as surgeons, what they can do, and as in medicine, what they can do. There's a major gap, and oftentimes these clients either can't or don't want to do the pharmaceutical interventions, and there's not a lot of options for them. And so transitioning them into a clinic that has these type of healing capacities, which is safe and non-invasive, they're just knocking it out of the park as far as the outcomes that they're seeing with their clients. And because of the neurologist background, he's using it on brains. And it is amazing, the stories that we're getting back. The point here is mainstream medicine is adopting it because now there is such significant research in the database, the National Institutes of Health. So more and more health professionals, and frankly, they're looking for cash-based revenue streams as well, because insurance is not a kind not a
Yep,
kind of
that's
thing for
awesome.
medicine. So
I'm glad we threw that clip in. So Valerie, thanks again for that. I'll have this video up in the next 24 hours. I'm going to send you the raw video footage and the
appreciate it.
finished one, and we'll look forward to talking to you again soon.
Thank you. Bye bye.
All right, take care. Have a great afternoon.
You as well. Bye bye.